Hi there. Today I want to talk about a few nutrients that could be really helpful at bringing down inflammation and improving our resiliency to being infected by viruses. In a previous video, I talked about how having a higher inflammatory baseline or set point can leave us more susceptible to complications and even death with something like the coronavirus. Today I want to talk about how to lower that inflammation with certain targeted nutrients. There's a chemical that gets elevated or that's been shown to be elevated in these individuals with higher inflammation known as NLRP3. And there's certain nutraceuticals that we know can actually lower this molecule through a variety of mechanisms, which I won't be going into in this video. But NLRP3 can then lead to the release of certain very potent inflammatory compounds, so we want to reduce it. Now, of course, there's some key lifestyle things that help it stay low, and one is balancing our blood sugar, so that's very important. Not consuming too many inflammatory fatty acids, making sure that we have low environmental stress and toxins in our environment, things that I have covered in the past. But there's also some key nutrients. So the first one is resveratrol. And resveratrol is something that we find in grapes, in particularly darker, red grapes. So we know that it shows up in wine. In wine, we're going to get about 3 to 5 milligrams of resveratrol per glass of wine. In a capsule, you're going to get 500 milligrams. So it just goes to show you that sometimes nutraceuticals can be a lot more powerful than the food version if we're trying to achieve a certain therapeutic effect. So resveratrol is really effective at that. Sulphoraphane is another one. We find sulphoraphane in cruciferous vegetables. That's broccoli, Brussels sprouts, cauliflower. I love broccoli sprouts, which are really powerful. So sulphoraphane gets activated when we chew these vegetables and when we break them apart and allow the enzymes in them, one of them called myrosinase, to activate some of those chemicals to make sulphoraphane, which can then go and decrease inflammation. So in our home, we actually have broccoli sprouts going all the time. We love them. Another one is quercetin. Quercetin's often recommended for allergies because it's a really powerful antihistamine, but it's also been shown to lower NLRP3. Quercetin is found in apples, it's found in onions. You can also, again, get it in supplement form. You can get just the regular form, or there's a more active form called enzymatically modified isoquercitrin, or short form EMIQ. And it's more absorbable, easier to get into the bloodstream. Quercetin's notorious for having a bit of difficulty getting it into the bloodstream, so you can use that form. And there's been some trials actually looking at quercetin and treating coronavirus specifically. One of the mechanisms, or another mechanism they're looking into, is its ability to actually help zinc get into the cells and help fight viruses within our cells. Another one is just potassium. Potassium's critical for many different processes in our cell, a lot of transporters on our cell membrane, but we can get potassium from eating lots of vegetables. Most people know that bananas have a lot of potassium, but pretty much any vegetable that you get your hands on is going to have really high potassium levels. So another example of how important it is to eat lots of plant foods. And then finally, berberine. Berberine comes from the herb golden seal. That's one of the herbs that contain a high concentration of it. And it's a pretty powerful molecule. It's actually been shown to also do some amazing things for blood sugar control. But again, here it has been shown to lower NLRP3 and decrease that inflammatory response. So we've got a really nice list there of things that we could incorporate both in the food form and in the supplement form to help you bring down your inflammatory load. Thank you.